You've probably heard of the terms incidence and prevalence before and memorized the definitions too, yet they blur together. These terms are often used interchangeably and create confusion. So instead of starting with definitions, let's imagine a simple picture and build the concept from scratch. Imagine a bucket filled with water. Above the bucket, there's an open tap which adds more water into the bucket. There are two different things happening: water that's already inside and water flowing in. We instinctively know those are not the same. The water flowing in from the tap are the new cases. That's incidence. The total water sitting inside the bucket at any given moment, that's prevalence. Now let's deepen our understanding. Incidence refers to the number of new cases of a disease occurring in a defined population during a specified period of time. Prevalence, on the other hand, refers to the total number of cases, that's both old and new, of a disease in a defined population at a given point in time or over a specified period of time. Mathematically, we just express incidence as new cases during a time period divided by the total population at risk during that period. Incidence tells us about the risk of developing a disease. For example, 100 people develop diabetes this year. That's incidence. With prevalence, we express it as total existing cases divided by the total population. Prevalence tells us about the burden of the disease. How many people have diabetes right now? Now let's return to our bucket to understand another key concept. If a lot of water flows in, the level rises. That makes sense, right? But if there's a hole in the bucket, what happens then? A lot of water flowing in would translate to high incidence, leading to filling of the bucket. But if there's a big hole, it means that water exists faster and doesn't stay in for too long. That is the case of high incidence but low prevalence. An example for this is the flu. There's a high number of new cases, but since people get treated quickly, so the prevalence remains low. Now, the other case is when water is flowing slower into the bucket and the hole is much smaller, so the water stays in for longer. That's a case of low incidence, high prevalence. For example, diabetes, where the new cases coming in may be low, but since people stay with the disease for a longer duration of time, the prevalence becomes higher. By the way, that water leaking out represents either cure, death, or migration. A quick recall for you is that incidence is incoming cases. That means the new cases, and it's always bound with time. It's used to understand what is the cause of a disease. We are measuring the risks here, and we develop a preventive plan. With prevalence, it's the present cases. That means it's new and the old cases or the existing cases. We use prevalence to understand the disease burden. So based on that, we allocate the resources and plan public health services. Even shorter would be incidence is equaling to risk and prevalence equals to load or the burden of the disease. Before we conclude, try answering these three questions. I want you to pause and think before looking at the answer. A district health officer wants to estimate how many hospital beds are required for tuberculosis patients this year. Which measure is most relevant? Incidence, prevalence, case fatality rate, or relative risk? The correct answer is B, it's prevalence, because we need to know how many people currently have the disease in order to plan the services. Second question, in a cohort study evaluating whether smoking causes lung cancer, which measure is most appropriate? Prevalence, incidence, proportionate mortality, or case fatality rate? The correct answer is B, it's incidence, because we are studying risk and new cases developing over a period of time. The last question is, a disease has low incidence but very long duration. Which is likely true? Low prevalence, high prevalence, zero prevalence, or high case fatality rate? The correct answer is again B, high prevalence, because cases accumulate over time. I hope you got clarity after watching this video, and I'll see you in the next session.